This is an in-service training program presented by Nutrition Care Systems. Today's topic is nutrition and hydration in the elderly. Upon completing this in-service, you will be able to state the risk factors for poor nutrition and inadequate hydration in the elderly, identify how risk factors can affect nutritional status, and be able to recognize the interventions to prevent inadequate nutrition, state the importance of maintaining an adequate hydration status, and then identify signs and symptoms of dehydration. There are several risk factors for poor nutrition and inadequate hydration in the elderly. The first one being chronic diseases such as diabetes, Parkinson's, renal disease, sensory loss like the loss of vision, depending on others for eating. Dementia can have a huge effect on nutritional intake. Depression obviously can affect intake also. And then being on multiple medications can cause problems with swallowing, can alter the sense of taste and smell, and then generally just suppress the sensation of hunger. And there are other risk factors involved. Change in the GI function, for example, dental problems, constipation, decrease in the energy rate or metabolic rate, a decrease in the cardiovascular function can have a huge effect on intake, a decrease in the renal or kidney function can also have a large effect, and then decrease in neurological function and a decrease in energy expenditure. So how do risk factors affect nutritional status? The resident may have a decreased interest in food just because the food maybe doesn't taste right. They have no taste at all, or maybe it doesn't smell right to them. They also may have an inability to chew food if they have problems with their dentures, or maybe just in general their teeth hurt, and also a decreased absorption of vitamin C and calcium. The elderly in general also tend to have a little bit more prevalence of lactose intolerance. There also might be cognitive issues such as memory loss, behavioral issues that can affect meal intake, or just their general interest in food. And the elderly also generally just need fewer calories due to decreased metabolic rate. They're just really not moving as much, and so their energy expenditure is down also. So there are some interventions that we can do to prevent inadequate nutrition. We can provide those residents that maybe are not eating well with a liberalized diet, like a general diet, and maybe they're on a no added salt or even a diabetic or a renal diet, low cholesterol, low fat. Let's try to get those discontinued by the doctor and just get them on a general diet. And then provide them any texture modified diet as needed, whether it's mechanical soft or puree. They also may need a multivitamin with minerals if they're not eating adequately. And also supplements are another angle that we can take, offering them Ensure, Boost, those type of things to help them give extra calories and protein throughout the day. We can also offer lactose-free milk to those that are lactose intolerant. And then we can also work with nursing and with speech therapy with those residents that may need help with setup or cueing at the mealtime. And then we can also provide nutrient-dense foods such as fortified cereals, maybe fortified puddings, fortified potatoes to add extra calories and protein for that resident. We're going to talk a little bit about water. Water is the most abundant nutrient in the body. It makes up about 50 to 60% of our total body weight. And dehydration is a condition that occurs when the output of urine exceeds the fluid intake. Water has many important functions. First one is it transports nutrients throughout the entire body. Water also aids with metabolism. Water helps to prevent constipation, which can be a real problem with the elderly. Water helps to regulate your body temperature. Water also facilitates digestion, and water helps to rebuild cells. It also cushions the joints and protects the body's organs. There are a number of factors that increase the risk of dehydration in the elderly. The first one is fever and/or infection, diarrhea and vomiting, medications such as certain diuretics, and elevated environmental temperature. Other risk factors for dehydration would include confusion or dementia. The resident just forgets to drink, or thinks they already drank and they really didn't. Inability to drink on their own. Many residents are not able to hold a cup or a glass. High protein diet can increase the risk, and dysphagia can cause an increased risk of dehydration. There are certain signs and symptoms of dehydration in the elderly that you as a staff member should be made aware of. Rapid weight loss is a sign and symptom. Dry skin is another sign and symptom of dehydration. Cracked lips, poor skin condition or fragile skin, fever, and vomiting. Also, if you see increased confusion, that is a sign and symptom of dehydration in the elderly. A decrease in blood pressure is also an indication. Dizziness, the resident complains of this. Increase in pulse, and concentrated urine. There are some things you as a staff member can do to prevent dehydration in the elderly. First one is to offer water. Water is really the best liquid to drink. There are some other good choices. Those include milk, juice, and flavored drinks. Coffee and tea cause the body to lose fluid, so the staff should really encourage the intake of water and fruit juices for the elderly. About 75% of the daily fluid requirement is obtained through beverages at meals, and the remaining 25% should be incorporated in the in-between meal snacks. Also remember when measuring that 1 ounce equals 30 cc's, which is an eighth of a cup. 2 ounces equals 60 cc's, or a quarter of a cup. 4 ounces equals 120 cc's, or half a cup. 6 ounces equals 180 cc's, or 3/4 of a cup. And 8 ounces equals 240 cc's, or 1 cup. What did you learn from this nutrition and hydration in the elderly in service? Question number 1. Which of the following is a risk factor for poor nutrition and inadequate nutrition in the elderly? A. Dementia. B. Multiple medications. C. Depression. Or D. All of the above. Did you get the right answer? Which of the following is a risk factor for poor nutrition and inadequate nutrition in the elderly? The answer, all of the above. Question number 2, which of the following interventions can prevent inadequate nutrition? A, a strict diet. B, nutrient-dense foods. C, do not cue the resident at mealtime. Or D, none of the above. Did you get the right answer? Which of the following interventions can prevent inadequate nutrition? The answer is B, nutrient-dense foods. Question number 3. Which of the following is not a function of water? prevents constipation, B, destroys cells, C, aids in metabolism, or D, regulates body temperature. Did you get the right answer? Which of the following is not a function of water? The answer is B, destroys cells. Water does not destroy cells. Question number 4. Water is the best liquid to drink. True or false? The answer is true. Water is the best liquid to drink. Question number 5. 4 ounces of liquid equals 1 cup. True or false? And the answer is false. 4 ounces equals 1/2 cup. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information, contact us at Nutrition Care Systems, 1275 Davis Road, Suite 121, Elgin, Illinois, or visit us on the web at nutritioncaresystems.com.